In September 2020, the number of Americans experiencing depression and anxiety hit an all-time high, according to nonprofit group Mental Health America. In December, 51% of adults surveyed by the Kaiser Family Foundation reported that stress related to the COVID-19 pandemic had negatively affected their mental health. While these statistics shouldn't surprise anyone, the real question is, what are we going to do about it? When it comes to our health, mental health in particular takes a backseat to physical health, despite the fact that the two are clearly intertwined. For instance, research has shown that adults who have depression as well as coronary artery disease are 59% more likely to have a serious cardiovascular event compared to others with the disease who aren't depressed. Depression and anxiety are also associated with worse outcomes for people with cancer, autoimmune disease, and other serious chronic conditions. Although there's still a lot we don't know about the virus, emerging evidence suggests that it has the potential to impact the brain and causes physiological changes that, when combined with the trauma of becoming ill with a novel virus during a pandemic, might make holistic care more important than ever. According to November 2020 research in The Lancet, an estimated 20% of people who contract COVID meet the diagnostic criteria for a mental health issue, such as anxiety or depression, within 3 months of diagnosis. A survey of 5,163 COVID survivors found that 79% of survivors complain of fatigue, 55% report headaches, and 54% say they have difficulty concentrating. Other common side effects include memory issues, dizziness, insomnia, and loss of taste and smell. But are these brain problems, emotional problems, or some combination of the two? Neuroscientist Dr. Carolyn Leaf says that the virus might attack the front lobe of the brain in some people, which is also the area responsible for decision-making, problem-solving, and impulse control. Decreased activity in this area could cause depressive symptoms as well as the mental fogginess that some survivors have described. For other patients, the virus might damage blood vessels in the brain or cause encephalitis, also known as brain inflammation. Long Island-based photographer Diane Barron had a mild case of COVID in March 2020, but developed severe headaches, insomnia, and even hallucinations in the following months. When Barron finally went for imaging tests, she was told that her head presented as if she had suffered a severe physical trauma, with doctors asking if she was positive she hadn't been in a car accident, when she never was. Even with all these cases, why does mental health still fall through the cracks? You might think that COVID survivors seeking out medical care for mental or physical related symptoms would be thoroughly evaluated for both, right? Wrong. According to the Survivor Corps Facebook group, COVID long haulers frequently complain about being ignored or even gaslit by doctors who insist the problem is, quote, all in their head. In April 2020, Brenda Bacta went to the ER with chest pain and palpitations that she thought stemmed from contracting COVID a month earlier. She was given Xanax and told to, quote, calm down, but her EKG ended up coming back abnormal, yet her doctor still thought it was anxiety. Bacta says, quote, there's an anxiety component and I know I'm depressed. But on top of that, she has many physical symptoms that include shortness of breath, chest pain, brain fog, and numbness and tingling throughout her body, but hasn't found a doctor to help her. And after recently asking her internist to get her started on antidepressants, she was turned down. But why is there such a disjointed approach to this? For starters, mental health has long been viewed as less important than physical health. On top of that, the healthcare system is overwhelmed, and mental health care is particularly lacking. But another issue stems from scarcity. Even before COVID hit, there still weren't enough psychiatrists in many areas of the country to meet the demand. Psychiatric illness rates have exponentially increased during the pandemic, and many individuals who've endured COVID-19 are waiting for months at a time to see a psychiatrist. Many have full schedules and no openings for new patients. Another big factor is money. Many Americans have their health insurance tied to their jobs, and the pandemic led to record unemployment levels. Even if you've managed to keep your job, and the insurance that comes with it, don't expect to have an easy time finding a therapist or psychiatrist who accepts your plan. Many of these experts don't even take insurance at all because of how little the insurance companies reimburse them. Even though there's been a lot of talk about mental health parity and even some legislation that technically ensures equal coverage for mental and physical health, there are major gaps in the system. While sweeping changes are likely to be slow going, there are also some positive trends. Post-COVID care centers are popping up across the country, and many of them do include a mental health component. Robert Wood Johnson University Hospital initiated an interdisciplinary program for COVID survivors that includes pulmonary doctors, internists, neurologists, and infectious disease specialists. The team also consists of social workers, occupational therapists, and psychiatrists. OSUMC, on the other hand, adopted a similarly integrative approach. Patients who were admitted to the hospital with COVID receive outpatient follow-up from both physicians and mental health specialists. The goal is to help survivors cope with their most pressing concerns, regardless of the cause. Of course, plenty of people who haven't contracted COVID are also struggling with depression and anxiety. Despite the fact that a large percentage aren't getting the help they need, there's still progress. Telehealth in particular has exploded this past year. According to a survey conducted by Tritium, more than 80% of behavioral health providers started using it for the first time during the pandemic. Remote access like this has the potential to make mental health more accessible to everyone. Meanwhile, several federal and private sector organizations, including the CDC and the National Action Alliance for Suicide Prevention, have created a coordinated national response team and launched an action plan designed to strategize ways to improve mental health care across the nation. One of the key goals is enforcing the Mental Health Parity and Addiction Equity Act, which is supposed to ensure that health insurance plans cover behavioral health as thoroughly as they cover medical and surgical care. It's too early to say whether these initiatives translate to lasting real-world change, but it's clear that, at the very least, the pandemic has prompted some people to talk more freely about mental health and acknowledge the existence of ailments like depression and anxiety.